Hi, today we're performing the steady state Astrand cycle test. This is my patient Katie. She's 22. She has a healthy BMI of 21.5. She is currently warming up at 25 watts and she's maintaining about a 50 RPM. She's monitoring that on the screen, so she's going to stay as close to that as possible for me. Her current level of physical activity, she's frequently active. She does various forms of physical activity, including different cardio exercises, yoga, and some strength training as well. We've adjusted the bike. When she was standing, we made sure it was at the level of her greater trochanter, and when she was sitting, we made sure her knee bend was about 5 to 10 degrees bent with her feet in the straps. She has no history of cardiovascular disease, and she's not at risk. She has a very low cardiovascular risk because no risk for dyslipidemia or prediabetes. Again, her BMI was healthy, doesn't have a smoking history, and she has a non-sedentary lifestyle. Her resting heart rate is 66 beats per minute, and her blood pressure at rest was 118/78. So these are all normal ranges. The normal heart rate to begin exercise should be between 60 and 80 beats per minute. Her respiratory rate is also 12, so she's good with that as well, because for that we're looking between 12 and 18 breaths per minute at rest. And then her resting systolic for normal ranges should be less than 120, which again was 118, and diastolic should be less than 80, and hers is 78. So she's good to go. She's now been warming up for 2 minutes and 15 seconds. We'll give her a little bit longer here. And then I'm gonna bump her up to 100 watts. I decided that based on her current physical activity level. She's fairly active, so we're trying to get her into her submax range, which is between 115 and 163 beats per minute. Her maximal heart rate range, which we measured taking her age into account, is 192.6. So we wanted 60 to 80% of that. That's how we get our range of 115 to 163. So once we start the test in about 10 seconds here, at minute 2, we're going to see if she's in that submax range. If she is, then we'll continue going. And then minute 5 and 6, we're going to do a heart rate sandwich. So 5 minutes, we're going to do heart rate, then we're going to measure her blood pressure, and then heart rate again at 6 minutes. All right, so she's been warming up 3 minutes now. We're going to bump her up to 100 watts. And we also have this mega RPE scale that I'm going to be checking in with her to see how she's doing. And how her exertion and physical activity should correlate with her heart rate. So we'll see if she's kind of matching that. It's a good way to check in with my patient as well. How are you feeling so far?
Great.
Is this a difficult level for you?
I think it's okay.
You're a frequent biker?
Oh, no, I'm not. That mile to school is just way too far to bike.
Yeah, Osceola Street's pretty far. So she's doing a great job of maintaining her RPM. She's staying right around 50. So that's how we know she's going at a steady state. So we're getting pretty close to that 2-minute mark. Katie, how are you feeling?
Today, fairly light.
Fairly
Right
light.
now.
All right.
A little more.
And the gold standard for heart rate while exercising is to do 30 seconds, so that's what I'm going to go ahead and do. When we measured at rest, we did a minute. so she's right at 118 beats per minute. So that's good. She's right in her submax range. I'm gonna go ahead and take her blood pressure to make sure that's increasing as it should be. I'm also gonna be turning my back to the camera so I can support her arm at the level of her heart. So her systolic is right at 132, which is a fairly good increase for what she's doing so far, and her diastolic was at 78, so same as at rest, which is good. We expect her diastolic to stay fairly constant, and her systolic is what should increase. How are you feeling?
Good.
Good. We got a minute left, and then we're going to check in again, see how our heart rate's doing, check her blood pressure again, and then again with the heart rate sandwich.
Extra cheese, please.
So at minutes 5 and 6, we would like her heart rate to be within about 5 beats of each other. Then we know that this max test has been successful, and we're okay to terminate at minute 6. If it's changed more than that, then we would keep going and try to get a constant heart rate. Doing a great job. You're just
Thanks.
biking to the dinner table. All right, so we're coming up on minute 5 here. Katie, how would you feel exertion-wise?
I'm saying somewhere between fairly light and somewhat hard.
Okay, all right. So that's right around the 11 through 13 range on the Borg scale. So we'll see how our heart rate correlates with that. Do heart rate first. So 62 for 30 seconds, so 124 beats per minute is what she's at, and that actually correlates pretty well with her perceived exertion. So we'll do blood pressure and then check her heart rate again. All right, very strong heartbeat. Her systolic is 142, her diastolic's gone up just a little bit to 80. So she's doing good. We're gonna go ahead and check her heart rate again because we've hit that 6-minute mark. See where it's at. So she's at 128, so she's right within that 5 beats per minute range. So we're okay to terminate the exercise and start to cool her down. So I'm gonna bump her back down to 25 watts, where I'll cool her down for about 5 minutes and be checking with her vitals again to make sure she's decreasing as she should. What's your final RPE? Let's see, how are you feeling?
No?
Yeah.
I'm feeling fairly light.
Fairly light.
Enjoying this.
All right, good. So she was in that somewhat hard range, right around, should correlate between 120 and 130 heart rate. And now as we're hitting the warm up, the cool down, she's decreasing good.